Hello, everyone. Today we will learn about the anatomy of the heart. First, let's read the question. 52-year-old man is brought to the emergency department by his son for evaluation of acute, severe chest pain and shortness of breath.
He gives a history of hypertension and dyslipidemia. Current medications include lisinopril and atorvastatin. His pulse is 105 per minute and blood pressure is 90 by 52 millimeters mercury. The cardiac examination reveals a normal S1 and S2. An electrocardiogram ECG shows ST segment elevation in the inferior leads 2, 3, and AVF. Given the symptoms and the findings,
Which of the following primary coronary vessels is compromised?
A. Diagonal branch of LAD. B. Left anterior descending artery. C. Left circumflex artery. D. Posterior descending artery. E. Right coronary artery.
This question is a composite of anatomy and physiology. Let us look into the high-yield concepts related to the topic. Here is how an anterior-posterior view of a chest radiograph looks like and helps in identifying the borders and surfaces of the heart, along with key structures in the surroundings. This helps in addressing questions related to chest wall injuries and symptoms caused by compression of the nearby structures. As you can see, the right border is formed from the right atrium, the superior vena cava, and the inferior vena cava. The left border is formed by the left ventricle, left auricle, left atrium, aortic arch, and pulmonary trunk. The superior border is formed by the right atrium and the left atrium, and the inferior border is formed by the right ventricle and the left ventricle. Similarly, the surfaces are important where a patient may present with a penetrating injury to the anterior chest wall, especially at the left sternal border in the fourth or fifth intercostal space. Since the right ventricle is visibly seen in the image to be positioned anteriorly, it will most likely be punctured. So the anterior surface is formed by the right ventricle, inferior surface is formed by the left ventricle and right ventricle, posterior surface or base is formed by the left atrium, apex is formed by the left ventricle, right pulmonary surface is formed by the right atrium, and left pulmonary surface by the left ventricle. Understanding the positioning of the heart is crucial for effectively navigating its corresponding blood supply. This image is a section showing the layers of the cardiac wall from outside to inside the heart. The first layer is the pericardium, which is further subdivided into two layers, an outer fibrous layer and an inner serous layer, which is subdivided into a parietal and visceral pericardium. The epicardium is the outer layer or the visceral pericardium which covers the heart's surface. The myocardium is the middle thickest layer consisting of cardiac muscle responsible for heart contractions. Endocardium is the inner layer that lines the heart chambers and valves, providing a smooth surface for blood flow. The space between the parietal and visceral layers is the pericardial cavity or pericardial space. This is clinically significant as fluid may accumulate in this pocket as a consequence of an underlying pathology called pericardial effusion. Note that the coronary blood vessels lie between the epicardium and the myocardium. The key blood vessels supplying the heart are the left coronary artery and the right coronary artery. The left coronary artery has four important branches, namely left anterior descending artery, also called the anterior interventricular artery, the circumflex artery, left marginal or obtuse marginal artery, and the artery to the AV bundle. The right coronary artery has five important branches, including the posterior descending artery, the anterior cardiac artery, the right marginal artery, SA nodal, and AV nodal branches. You need to know the areas these branches supply and can visualize this easily by the following diagram. Now, first, if we see the left anterior descending artery, that supplies the left ventricle, right ventricle, anterior two-thirds of the interventricular septum, and the anterolateral papillary muscles. The left circumflex artery supplies the left atrium and the left ventricle. The left marginal artery supplies the left ventricle. Then the right coronary artery is subdivided into the posterior descending artery, which runs in the interventricular region posteriorly. It supplies the posterior and inferior surfaces of both right ventricle and left ventricle, and the posterior one-third of the interventricular septum, along with the posterior medial papillary muscles. The right marginal artery supplies the right ventricle and the apex of the heart. Here we can see the inferior view of cross-section through the ventricular plane. Anterior surface of the heart is mostly supplied by the left coronary artery, whereas the inferior or diaphragmatic surface is supplied mostly by the right coronary artery. Here is a quick look into cardiac dominance. Just remember, the origin of the posterior descending artery determines the dominant circulation. If a person is right dominant, it means the PDA is supplied by the right coronary artery. If the person is left dominant, it means that the PDA arises from the left coronary artery. Another small fact is that blood flow peaks in early diastole, when the heart is relaxing or filling itself. Sometimes you can be tested on the nerve supply indirectly, and usually this presents as referred shoulder pain of pericarditis. Since the same nerve roots extend to the shoulder region, the fibrous and parietal layer of the serous pericardium are supplied by the phrenic nerves. The visceral layer of the serous pericardium is supplied by the vagus nerve and sympathetic trunks. It is vital to know the physiology of each of these conductive tissues. However, it is best to keep yourself aware of the anatomical location of each component. The SA node is found in the upper part of the sulcus terminalis near the opening of the superior vena cava. The AV node is found near the atrial septum. The bundle of His passes from the AV node through the AV septum into the interventricular septum. The right and left bundle branches travel down the interventricular septum, with the right bundle branch going to the right and left bundle branch going to the left. Purkinje fibers are present in the subendocardial plexus. Whole of the conducting system except the left branch of the AV bundle is supplied by the right coronary artery. Coming back to the question, it shows that a 52-year-old man has presented with acute severe chest pain. He is hypertensive and has dyslipidemia. His blood pressure is low. An ECG shows elevation of the ST segment in the inferior leads, and they are asking us about the primary coronary vessel that is compromised. To tackle this question, it would be necessary to know what the changes on the ECG leads mean. However, since it mentions inferior leads, the most likely answer would be right coronary artery. It would be best to memorize this table, as this is a high yield concept and is frequently tested. There you can also see that the inferior wall is supplied by the right coronary artery and the ECG findings are given. These diagrams will be helpful once again while you're navigating through blood supply of the heart. Feel free to go over the answer explanations. This is the takeaway key point, that the right coronary artery supplies the inferior wall of the left ventricle via the posterior descending artery. So I hope this was helpful and that you can navigate your drone more easily the next time while solving a question. Please leave your suggestions and questions in the comments. Stay tuned for more and don't forget to hit subscribe.